Okay. Maybe around 6 minutes.
Yeah.
You'll start. So you also teach online in Saudi Arabia, or
Yeah,
they already?
for the previous whole year we were teaching online. Even the exams were online. Like this, the midterm was on paper, but the final term exam was online for the last semester and the semester before.
Hmm. So still by online.
Yeah,
Hopefully, yeah,
but they have announced by the Ministry of Education that from next semester it is necessary that it will be physical
yeah.
and everyone should get vaccine. And
Oh yeah. So you already get a vaccine in
I
Saudi
got
Arabia?
the first shot only,
Hmm.
and that too I got from Saudi Arabia. For the second dose, I'm still waiting to get from here.
Oh yeah, yes. In Oslo.
Yeah,
Hmm. Yes, we in Taiwan we still have problem with the vaccine, but but
mm.
in Indonesia it's quite better because we also get vaccine from China.
Yeah, same like in Pakistan also. Most of the people they are getting this Sinovac.
Hmm.
That's from China. Now actually they also started producing locally in Pakistan. The same one, just reproducing it.
Oh,
Sinovac.
so Pakistan also produce locally
Yeah,
COVID vaccine.
yeah, yeah. The same vaccine which is actually provided by China. They are just, you can say, reproducing it.
Oh, okay, okay.
The
It's
formula is
similar.
same one.
Yeah,
Yeah.
similar in Indonesia since Sinovac also for the clinical
Trials.
stage. Yes, the third
Yeah.
stage it's also held in Indonesia. We also
Mm-hmm.
have collaborate with the Sinovac and hope
Mm.
that we can produce by ourselves.
Yeah.
Okay, thank you so much.
Thank you, Lina.
Mhm. Hope in the future we'll have research collaboration.
Inshallah. Sure, sure.
In Indonesia, could you hear Professor Suleman voice? Professor Lukman? Hello?
Yes, we hear.
Okay.
We are still waiting the Dean and Vice Dean, right, Budina?
Oh, yes, yes. Please wait a moment, Professor Suleiman. We
No
will
problem.
wait for our dean or our vice dean to give welcoming speech
No
before the
problem.
lecture.
Professor Usman, can we start now? Sorry, Professor Suleman, can we start now?
Yeah, sure.
Okay, because the dean and the vice dean are still in their business because many agenda today. We can start now.
All right, no problem.
I will be as your moderator today.
Okay, good.
Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon, everybody. The Honorable Professor Suleman as our speaker in this virtual lecture. And all the audiences and students attending this lecture. It is an honor for me to guide remarkable guest lecture organized by Faculty of Sport Science Universitas Negeri Semarang. Among us, Professor Suleman will deliver lecture about public health surveillance during Hajj, and he is from Department of Health Informatics at College of Public Health and Health Informatics, University of Health, Saudi Arabia. The topic is very interesting because Indonesia is the biggest group of Hajj during the Hajj session, and we are very happy to have you today. And also in this occasion, I would like to say thank you to Professor Dina because of your help. We can make this virtual lecture well. And before we get started, Professor Suleman, I will share. I'm so sorry. I will share some information to our student. To our students, please open your camera and turn off your microphone. Once again, to our students, please turn on your camera and turn off your microphone. And please change your display name in your Zoom with the format name underscore institution. For example, Lukman underscore UNES. And please behave appropriately during the virtual lecture. And question can be asked by chat menu, or you can directly ask to the professor. And do not forget to subscribe the YouTube channel of faculty and our department. And in the end of the virtual lecture, I will show you the link of the certificate issuance. So do not leave the Zoom. And this link is active for only 60 minutes after this virtual lecture is over. Once again, to our students, please open your camera and turn off your microphone. And then I would like to show you the curriculum vitae of Professor Suleman. He is from Department of Health Informatics, University of Health, Kingdom of Saudi Arabia. And for his education background, his PhD is from Taipei Medical University, and the master degree from Islamabad, Pakistan, and also the bachelor from Islamabad, Pakistan, about the research project related with spatial and temporal distribution of chronic disease, and also in epidemiological investigation of COVID-19. And about this publication related with Hajj in the time of COVID-19, investigating spatio-temporal distribution in Pakistan, the impact of different surgical procedure, and meteorological influence on dengue transmission. So without further ado, I would like to welcome Professor Suleman to deliver the lecture. The time is yours.
Thank you so much, Professor Lukman, for this nice introduction. I would share my screen and then I would stop. Okay, here it is. So for today's presentation, the topic is how Saudi government is performing the public health surveillance during the Hajj. As you know, Hajj is probably the one of the biggest religious mass gatherings in the world. So it is important to closely observe or see the situation about the diseases, epidemics, and pandemics, because the people from all over the world would gather to perform Hajj. And if there is anybody, like we can see if someone is having COVID-19, and you can imagine the impact or the spread it would cause around the world. So that was the reason last year only 1,000 people were allowed to perform the Hajj. So this was actually, I must say, it was very good of the Saudi government that rather than going the traditional pattern, they reduced the number of pilgrims. Usually, like more than 50 lakh people are performing the Hajj. I will show you the graph which is showing the number of pilgrims every year. And now what happened last year? It was actually only 1,000 people performed the Hajj. And this year they have just announced, I think a couple of weeks ago, this year only 60,000 people are allowed to perform Hajj. And those two which are residing inside Saudi Arabia. No one will come from outside of Saudi Arabia just for the sake of Hajj. So the people living inside the Saudi Arabia from different nationalities or Saudi nationals, they will be allowed to perform the Hajj this year, and the number is 60,000. Anyway, so we will start with the significance of is my screen, you can see it full. Not sure. I Yeah, no, I think should be full.
Yes, now it's full.
Okay, good. So, so the first of all, we would learn about little about with the significance, why it is important, what is the significance of having this public health surveillance. Because this disease prevention and control is a national, regional, and international public health priority during Hajj. Why? Because the people from almost all the nationalities, Muslims, are gathering there, and this is actually ample time for the people to, if someone is prone, may get infected with this like a virus or a bacteria or any causative agent. And once they finish this ritual, they go back and they can spread it easily. Like I would give you example of COVID-19, because people are coming for Hajj and Umrah. For Umrah, they are coming around the year. For Hajj is specific time in Zil Hajj. So actually, the last year when this COVID-19 started, if you would see my paper, I will mention it later. That this my first paper, which is mentioned in the introduction, Hajj in the times of COVID-19. The first case in Pakistan and the first case actually in India, both of them basically were the Umrah returnees. They perform the Umrah, they go back to their countries, and both of them actually died in if you see that paper, it is mentioned. This I got from the media reports. In Saudi Arabia, it is coming from Iran, but in Pakistan and India, the case actually spread from because of the Umrah. At that time, no one knew that it was spreading so fast and it was reaching to the other country. That is why it is very important, not only locally, like at a national level, or just in the regional level, like in the Middle East, because the transport in the Middle East is majority of the people travel by bus, like from Iraq, from Emirat, Oman, Bahrain. They are linked by road, but the people from far areas, they travel by the planes. So that is why it is very important, not nationally, but also regionally and internationally. So the deployment of enhanced disease surveillance system is recommended for mass gathering. Mass gathering, when we say there are a huge amount of people gathering at a certain place to perform either some ritual or for some political reason, for a protest or like anything, when there are more people gathering, so it becomes more important to take care of how the people are gathering, whether they are following the protocols or not, because this may lead to spread of the disease. And in this, I would like to mention about in the beginning of COVID in Pakistan, there is a big religious gathering, which probably some of you know, in Rawalpindi, Lahore. This is a religious gathering, like not Hajj, but they would preach and discuss about the Islam. So this was one of the reasons in the early days of COVID-19 for spread of COVID in Pakistan, because people from all the cities of Pakistan, they come to Lahore for this gathering, and then this is for 3 days, and after it is finished, the people go back, and then wherever they go, they spread this COVID-19. So this enhanced disease surveillance system is recommended for mass gatherings to facilitate rapid detection and response to the health threats. So rapid detection is very important in this thing. If we are able to detect or diagnose something is there, then we can, respond, or we can tackle it in time. If we are late in detecting it, means we don't know there is a danger. So we will not be able to handle it, tackle it in a timely way. So here is basically the I, I wanted to just okay. Here is you can say how the Hajj is performed. Like what are the places? There are different places. Different rituals are performed at the different places. For example, for the start of the Hajj, it would start from the Kaaba, holy Kaaba in the Makkah. So from there, the people would go to Mina, where they are going to perform 5 prayers, uh, and then they would go to this Arafat, which is like a big field where they would make their tents and they stay. And then after the Maghrib, after the sunset, they will go to Muzdalfa, where uh, they are, throwing those stones on symbolic level. And then next, they uh, go to the Mina, and there they basically are doing this sacrifice for the goat or animals, where they distribute this meat to the poor people. Although this is not the situation right now, because most of these things, just to handle these big gatherings appropriately, these are done by the government, so you just have to be there, use, not like old times. And then finally they return to the Makkah and perform the tawaf again. So this is the timeline for how to say performing the Hajj. So as you can say, there are 6 different spots where the people are coming. So we need to take extra measures at each and every spot, because if there is anything where we are not taking care, or we are negligible, so this may spread not just locally but even to the other countries. So this is the graph which I was talking about. You can see the number of Hajj pilgrimage from this was the previous 5-year data which I shared in my paper on Hajj during COVID-19. So you can see in 2015 there are 56 lakh people, and in 2019 there are 74 lakh people who have performed Hajj. You can see there is gradually the trend is increasing, but what happened next? In 2020 there was COVID-19, and there was only 1,000 people who performed Hajj. And this year they have announced already there will be 60,000 people. So there is a gradual decline. There is a gradual increase here, but then after the COVID, last year it was 1,000, now is 60,000. So there will be gradually they will increase the number of pilgrims. So you can see the impact it is going to have on the daily lives, on the economy, on the on the religious lives of the people. So that is why it is very important to take care of having strong surveillance system. If there is no strong surveillance system, so we have to face such kind of unprecedented situations. Uh, okay, so now we will see what kind of diseases during Hajj has been during the past. And this is not only like, this is not happening only for the first time. This has been also in the history, like maybe 1,000 years ago, there was a situation like this. So the first time an epidemic of any kind caused Hajj to be cancelled was a plague that happened like 967, Anno Domini AD. And then the drought and famine caused the Fatimid ruler to cancel overland Hajj routes in 1048. So you can say 1,000 years ago. Now we are in 2021. Then there were cholera outbreaks in multiple years throughout the 19th century, like the previous century, which claimed thousands of pilgrims' lives during the Hajj. One cholera outbreak in the holy city of Makkah and Medina in 1858 forced thousands of Egyptians to flee to Egypt's Red Sea border, which is near the Jeddah, where they were quarantined before being followed back in. And then there was an outbreak of cholera in India in 1831. This also took lives of thousands of pilgrims when they were on way to perform the Hajj. So you can see this is from different parts of the world, causing not only disruption for the pilgrims, but also taking their lives. So different diseases in the different time periods. It could be plague, it could be cholera, now it is COVID. And locally, during 2010, 11, 12, 13, there was Middle Eastern respiratory syndrome, MERS virus. That is also a type of coronaviruses that also caused disruption during 2010 to 13. So recently, 2012 and 13, Saudi authorities encouraged the ill and elderly to not to undertake Hajj because of concerns over Middle East respiratory syndrome or the MERS. Why? Because the fatality rate for the MERS is much higher. Even it was more than this COVID-19. COVID-19 is having very low, but this one for the MERS, it was very high. This spread from the camel because in the Middle Eastern region, majority of the rich people, they have the camels, and it is kind of pride in their region. And this would spread by this what we call as the camels. So this is the timeline. How if someone is infected, then how early or how late he or she is going to spread it. So for example, if someone is coming in the kingdom of Saudi Arabia, KSA means Kingdom of Saudi Arabia, on day 1, and one person is infected. On the day 6, he is developing symptoms, and then day 11, he is infecting another person. Day 7, pilgrim C is infected. And then on day 12, this guy will also, on the day 12, will also develop the symptoms. And then 14 or after that, they are going back to their own countries. And then pilgrim B develops symptoms after returning home. So, it is not just they are developing symptoms, they are spreading it locally, but also they are spreading it once they go back to their home countries. So on the day 14, earliest day, uh, he is going to infect, and at that time he is already back to his own country. So this is how this COVID-19, it depends on what kind of virus or bacteria it is. So this will cause a spread to an international level. So now we come to this overview of how these surveillance systems work. So the surveillance system, for example, this is taking data from the physician's offices, alerts generated by the governments, then different registries, hospitals, as well as the laboratories. So they are having the data which is about the family health, either National Health Safety Network, inventory about the diseases, immunization, like who has been vaccinated or not, other notifications, information about the outbreaks, other investigation, as well as work management. So this uh, will, these are the essential um, public health business applications, and they share either the reports or different charts, or the it is also giving us the user interface where we can interact with the system and the data in the system. So types of infectious disease surveillance operations during Hajj. So what kind of surveillance operational tools are done, or what kind of regular or irregular surveillance systems are there. So the first one is regular infectious disease surveillance, which is like not just only Hajj, but it is always working. Then enhanced infectious disease surveillance. So to make sure that no one during the Hajj is uh, getting infected or spreading. And then points of entry surveillance, like for example, people from Pakistan are coming to maybe Jeddah, people from Indonesia are coming to Riyadh, or people from Middle East are coming to Dammam, like different ports of entry for different regions. So at the port of entry, where the people are entering inside the Saudi Arabia, there they are also doing the surveillance, checking, and diagnosing if there is any issue. And then is health facility level surveillance, which is basically during the Hajj. And then medical office for pilgrim level surveillance. This is during the Hajj, which is in the, you can say, which is in the Makkah. So we will see in detail about all of these surveillance systems. So the first one is regular infectious disease surveillance system. So this is indicator-based infectious disease surveillance, which is implemented countrywide, like around the Saudi Arabia, and this is routine facility-based notification of infection. So anyone who is infected with an infectious disease, the data is being reported by this IDS, and this is round the year, even during the Hajj. So each regional public health directorate is made up of 3 to 6 administrative subunit known as health sectors. So these 3 to 6 administrative subunit, they are reporting to the regional level health director. There are 13 regional directorates in Saudi Arabia. Ultimately, this is going at the national level. So the surveillance teams at the regional level, they will be compiling the data, which is pulled from all those health sectors on specific disease Excel sheets for monthly reporting to the Central Directorate of Public Health and the Ministry of Health headquarter. Like centrally, all the data is going to the Ministry of Health, and they are collecting this data on the monthly basis. Then is the enhanced infectious disease surveillance system. So this enhanced IDSS is activated only during the Hajj season, so that early detection and the rapid response to infectious disease outbreaks could be done. So this is active at 3 main points, which is key points of entry to the kingdom, then healthcare facilities in the Hajj areas, and the medical office for the pilgrim. So this enhanced infectious disease surveillance is working at only 3 points, not all over the Saudi Arabia. First is where the pilgrim or those who are going to perform the Hajj, where they are entering in the kingdom, either at the airport or they have some assembly point in Makkah, or the healthcare facilities in the Hajj areas, which they always make. I know the teams, the medical team from different countries, they would always go. Definitely from Indonesia, they would also go, because from Pakistan, every year they have this health teams which are accompanying the Hajj. They make their stalls and they oversee the people during the Hajj. And the third point is medical office for the pilgrims. So the first one, point of entry surveillance. So this is effective surveillance at the point of entry is required to prevent and control the international spread of disease. So the main point all of the time here is that the purpose of this surveillance system is not only to stop the someone infected is coming inside. Not only this, but also that if someone is infected, he is not going to take it back and spread it back in home, because these mass gatherings events, they are basically super spreader, like they can spread at a huge scale. So this including the import of infectious agent to the host country, not only spreading but also import. So this will make sure that there is no import of infectious agents. So at each point of entry, the surveillance team review the vaccination status of arriving pilgrims by checking their vaccination cards. Like I know inside the Saudi Arabia before the Hajj, everyone is required to take this flu shot. So they will take this vaccine so that no one is getting flu or is spreading to the other people. So if there is any reported case of unvaccinated pilgrims or those with unverifiable vaccination status are recommended appropriate actions for these cases. So whether either they will be vaccinated or they will be sent back. But now these things are done actually in the home countries. So if someone is coming from Indonesia, he will be getting his required vaccination before he would travel to the Saudi Arabia. So the surveillance teams are also responsible for identifying and managing ill pilgrims. Like this is not like always you are having an infectious disease. You may have any other health condition. So if something happens in emergency, so the medical centers, the health teams are there, which will provide you the health care. So, and the notification and transfer of suspected cases of infectious disease. If there is any such case, they would manage it or notify it so that it can be separated from the other people. Next is the health facility level screening. So this is hospital-based surveillance teams. They are operating in each hospital within the Hajj, like in the Makkah region. So there are hospital staff trained to rapidly detect and report manually and electronically cases of infectious diseases which are presented to those hospitals. And any suspected case of infectious disease which is identified at primary health center, they are referred to pre-specified hospitals for confirmation of diagnosis to make sure whether the person is really infected with this disease, and further management and notification to the this CC command and control center. And the medical office for Pilgrims-Level surveillance. So the HUD medical office for pilgrims refers to the healthcare representative of some countries. Like I told you, I know there is a team from Pakistan because earlier some years, one of my friend actually came with the same team in this Hajj mission, which they send the pilgrims for Hajj and accompany Hajj pilgrims during the event. So it becomes actually easy to relay the information, to convey or communicate with the pilgrims. So they set up clinics or hospital within the Hajj areas, like it could be at Mina or Muzdalifah or Arafat, like those where the people are going to stay. So they will set up their camps and provide healthcare services for their own pilgrims. Means the Indonesian team will be providing this healthcare services to the Indonesian people. Pakistani team is going to provide services for their own people. Similarly for the Arabic, because these are the major countries which are from which these pilgrims are going. Services for their own pilgrims in compliance with the Saudi Ministry of Health rules and regulations. So they are provided those rules. So the composition of medical staff for pilgrims varies from country to country, but minimum of 20% of their staff should have a public health background. So this would not only include the doctors, but also pharmacists, nurses, and even the minimum 20% of the staff would be from the public health background. So in this team, multiple and interdisciplinary professionals will be there. So now there are two types of tools which they are using there during the Hajj for the infectious disease surveillance. So there is for this electronic surveillance system, there are two. One is Health Electronic Surveillance Network, The second one is electronic statistical system for Hajj, which is CITR. So these are the two systems they are using during Hajj. So the first one is HESN, Health Electronic Surveillance Network. It was implemented as a pilot program in Makkah in 2012. First time it was implemented only in the Makkah, but then by January 2014, it was implemented around the country, around the Saudi Arabia, when there was outbreak of MERS-CoV virus, Middle Eastern Respiratory Syndrome coronavirus. So the hospital surveillance teams, they collected, compiled, and entered the infectious disease data directly into this HESN once a notification is received from the laboratory. Because basically this is collecting data from the laboratory, from emergency rooms, isolation wards, or any other which is actually notifying any infectious disease. So the data from these departments, laboratory, emergency, isolation, is going to this HESN network. The next one is electronic statistical system for the Hajj, which is CITR. CITR is a web-based electronic solution that predates HESN. Actually, before this HESN was CITR. But unlike this HESN, which is around the Saudi Arabia, CITR is used only during Hajj to manage infectious disease data which is captured in real time. Like now it is being reported and they are directly entering it into the system from the health facilities in the holy areas. And those holy areas include Makkah, Medina, Arafat, and Mina, like where majority of the pilgrims are going. Although the hospital surveillance teams entered data entry into the GSN, the fixed surveillance teams captured the same data into the CITR. So according to Saudi Vision 2030 framework, which was released in 2017, it has now they want to digitalize everything. They are rapidly digitizing all the things, including the healthcare. So COVID-19 enabled the promotion and testing of this transition. I don't know if some of you were present in my last presentation like a couple of months ago. I mentioned about several applications which Saudi Arabia has used during this COVID-19 outbreak. So they were very slow before this COVID-19, but as this emerged, they have implemented and used new digital tools which they were already working on, but they got a chance to really implement it and expedite those tools. So the Saudi government and private sector combined, developed and launched approximately 19 different applications, like 7 or 8 I mentioned in my last presentation, that serve the public health function and provide healthcare services. Like you want to book an appointment, you have you want to track where if someone is infected, there is a different application. Now, you want to go for Umrah or Hajj, there is an application where you can book an appointment. You want vaccination, there you can book an appointment. Like there are, you want to get a lab test for COVID-19, there is an application. I have used, 4 or 5 I have personally used for, when I was there for the traveling, for testing, for booking permit, like, so they have successfully used these tools for the surveillance during this COVID-19. Then there is a global center for mass gatherings in Saudi Arabia. Why mass gathering? Because this is the biggest mass gathering, religious mass gathering in Saudi Arabia, Hajj and Um. So the government's high level of awareness and readiness resulted from lessons which they learned during this H1N1 pandemic in 2009. So the ministry's Global Health Center of Mass Gathering, which is also a World Health Organization collaborative center for mass gatherings, and this showcased the country's ability to develop detection, management, and prevention scenarios for infectious disease outbreaks through years of research. So, on the recommendations of World Health Organization (GCMGM), uh, they did a health risk assessment for Hajj 2020, which was last year, for which I told you they reduced the number, which was, if there was no COVID, there would be definitely more than 80 lakh people would be performing the Hajj. But after the health risk assessment and the recommendations of WHO, they decided that only 1,000 people will be performing the Hajj. So this slide is about that. So this was, they did it using the JADA tool, which is a health risk assessment framework for mass gathering to estimate the health risk of COVID-19 at the pilgrimage. The assessment modeled an expected burden of COVID-19 using several tools, including attack rate, country Hajj quota, and WHO's Global Disease Severity Index. The risk assessment identified and prioritized all potential hazard from previous Hajj records and current and local international events and outbreaks using an all hazard approach. Vulnerability and capacity assessment were then conducted for prioritized hazards to identify the highest risk. So they did extensive analysis to make sure that they don't invite more people which they can't manage or which may lead to make it like a super spreader event. To avoid that, they use those recommendations. So the assessment showed the current number of designated health facilities for Hajj rituals to be severely insufficient. They always have those medical centers, those facilities and teams, but they know that 2.5 million pilgrims during COVID-19 pandemic due to high transmissibility. If they want to have like 25 lakh people, they don't have the facilities to manage it. So based on that, they decided to reduce number of pilgrims who would attend the Hajj in 2020. So, and then on June 28 last year, just before the Hajj, the World Health Organization, they appreciated that decision which was taken by the Saudi government. And here I would like to mention about this hadith. It says, إِذَا سَمِعْتُمْ بِالطَّاعُونَ بِأَرْضٍ فَلَا تُدْخُلُوهَا وَإِذَا وَقَعَ بِأَرْضٍ وَأَنْتُمْ بِهَا فَلَا تَخْرُجُوا مِنْهَا. What does it mean is that if you know there is a plague, or you can say it is a symbolic word, if there is a plague or there is any infectious, don't enter into that area, or don't, if you are there, don't leave that area. This is a, you can say this is promoting this quarantine rules. Like, stay where you are. If you will move to other places, maybe you will spread it. Or if you don't have it and you go into that area, you will take it, like how COVID-19 spread. So this was the philosophy is basically so that if there is a chance of spread, it's your health is more important than anything else. So better not to visit those areas or go into those places. Even it could be, Khana Kaaba, Baitullah, or Masjid Nabawi, or whatever. So here is the timeline of decisions which were related to Hajj and Umrah. Uh, when the Saudi government they know about the COVID-19, the first case was detected on 2nd March, but they suspended the international entry for the Umrah purpose on 5 days before, like 27 February. The reason is actually 28 February was already, some people were infected and they traveled back, as I gave you example for India and Pakistan. They are, the first case is being detected here on 2nd March, But the person who died in Pakistan, it was already, I think, the first March, one guy who returned from Umrah, he already died in Pakistan. The same was case in India. And then on March 4th, they suspended Umrah rituals in Makkah. Like we were not allowed to go inside Makkah to perform Umrah. March 25, they suspended the exit and entry of cities of Makkah and Medina. Like those who are inside Makkah and Medina, they cannot come out, and those who are in other cities, they can't go there. So it was like they make this strict entry and exit. Then on April 2nd, they put full curfew in the cities of Mecca and Medina. On May 31, they again reopened Prophet's Mosque, Masjid Nabi in Medina. And then uh, on June 22, they announced and confirmed the Hajj, like how many people are going to perform the Hajj in 2020. So, what are the measures, preventive measures before the Hajj? So, the people who are between the age of 20 and 65, and those who are more than 50 years, they will have to follow certain rules. They were allowed to perform the Hajj. They should not have certain high risk chronic disease. Actually, I also applied for Hajj at that time, but I was declined because I am also in this chronic disease group. And the person should not be obese. The pregnant are not allowed to perform Hajj in that in last year, and they should have a negative PCR test for COVID-19. So these were the prerequisites when if you want to perform Hajj last year, like if you want to apply for Hajj. So all eligible candidates were scheduled for appropriate medical examination and screening visits. Each candidate received clear instructions to quarantine for 14 days. So before the Hajj, 14 days they have to quarantine either in a hotel or their home. 10 days at home or in a hotel before travel, and 4 days in a facility once they arrive in Mecca. Then adherence to the quarantine measures was monitored and enforced using a national electronic application known as Tataman, which I mentioned in my previous presentation. So Tataman was one of the applications, which means in Arabic, it means to reassure, like you are not having the COVID-19 and you are not prone to it, like you are not spreading it. So the application monitored daily symptoms and provided educational information for the users. It was linked to smart wearable electronic tracing bracelet. It generated alerts at the regional health command and control center if candidate violated quarantine measure. Like if someone is going out during the quarantine time, so it will automatically generate the signal that send the notification that the person is violating the rules. So the recommended preventive measures were explicitly stated for all pilgrims. And other measures included a physical distance of 5 feet, which is 1.5 meters, face mask wearing, practicing safe and hand hygiene, like washing and using those sanitizers. And if you are suffering from any symptoms or you have contact with any confirmed COVID-19, then you have to disclose it or inform in a timely way. Then, what were the measures they took during the Hajj? So, safe bubbles and tracks, pilgrims were assigned to groups or bubbles of 20 pilgrims with designated tracks by number and color. So, to make sure that not more people are becoming together, they make groups of 20 people. These tracks specified, for example, which waiting post, housing, and bus and seats each bubble would use during the long Hajj journey. Like you have to go from Makkah to Muzdalfa to Arafat and different places, and you have to spend like 24 hours or 12 hours at certain places. So you are not only praying, but you have to also take rest. So they are putting tents or housing facilities. So to avoid any kind of gathering, over rushing, they put certain measures. Then group organizers, healthcare professionals, hospitality staff, and other drivers. Like each group is having a particular uh, hospitality staff, drivers, or whatever things they need. Then health officers, so a group of 50 trained health officers accompanied the pilgrim during each step of Hajj. Like their 50 health professionals are always there to provide the maximum level of care. For example, measuring temperature frequently, checking symptoms, responding to all medical complaints, and ensure all adherence to the prevent. Oh, and one thing I would like to mention, like they actually gave priority to the health care staff. Like in the 1,000 people, majority of those were basically the healthcare staff who are working in the hospital, because they know what kind of measure we need to take, and they can also help others. And many healthcare people actually died last year. So as a part of showing the gratitude to them, the government gave them priority last year to perform the Hajj. So health officers assured medical concerns accordingly and arranged expedited transfer to medical posts with dedicated equipments and staff for further management. Then standby critical care ambulances were available to transfer patients to designated beds in the nearby hospitals if needed. The communication and event command system was well designed and applied. So special training and eligible criteria were not just for pilgrim, but also included for the people providing services relevant to Hajj. So they were categorized according to their proximity and interaction with the pilgrim, like hot, warm, or cold zones. Zones were provided and measures like PCR testing, quarantine training with were more stringent for those which are in the hot zones. This is actually, you can say, the healthcare personnel, the drivers are those who are actually taking care of the pilgrims. So these are zones for those people. Then there are preventive measures. So this include provision of pre-packaged meal, no buffet. Before the COVID, there is open buffet system, like the food is there, you can go and eat. But this last year, they would pack your food and they will provide you. So there is no interaction, no sharing of utensils or personal instruments. Like you can know, it's very common to share the chargers or some utensils. So to avoid this, they strictly prohibited it. No physical touching of the Holy Kaaba and other high touch surfaces. Like everyone want to touch this Hajar Aswad, so it was not allowed. No, actually, like I went for Umrah 2 times recently. You can't even go close to the walls of Kaaba, so you have to stay away. Provisions of sterile pebbles for each pilgrims when they want to on the throwing rituals, like when they want to send the throw the stones and the Saturn. So those pebbles, they are already sterile and sanitized. Then provision of prayer mats for individual use. Uh, in the Khana Kaaba, they won't let you in if you don't have your own prayer mat. In Masjid Quba, they have those kind of one use prayer mat, which is made up of these like the material which is used for these shopping bag, the similar kind of material there, it is used to make those prayer mats. Once you want to, if you have your own, it's fine. If you don't have, they would give you. So you have to take it, pray on that, and once you are coming out of the mosque, you have to throw it like this. They are providing this kind of services for individual use. So what happened? What was the outcome of this season? only 1,000 people from 160 different nationalities, which are within Saudi Arabia. They were selected to perform the Hajj in 2020. So the number of pilgrims included 2020 Hajj was an official decision based on health risk assessment, which we discussed earlier. So, given the significant socioeconomic, religious, and health security implications, no confirmed case of COVID-19 was recorded among all pilgrims during or after the end of the Holy River. So, as a result of taking these measures, there was no case of COVID-19 in the pilgrims. So, mass gathering impose grave challenges to healthcare systems and security authorities, especially COVID-19 pandemic. So, a reduction in the number of pilgrims was a courageous and well calculated decision, and the outcome was also good, based on the risk assessment and wide consultation with relevant stakeholders, including the religious leaders. So, this collaboration between Saudi government sector was one of the critical success factors for the risk mitigation plan during COVID-19. And it was not just by the government, but also by the non-governmental organization. There was support for tackling. KAUST is King Abdullah University of Science and Technology. This is the biggest research institution, as well as can say the one of the finest Saudi universities. They have every year a kind of open call for challenges, or to collect ideas to develop different research projects. So last year their challenge was actually about this religious mass gathering. So in the challenge last year, what they did is they asked for the people to give novel ideas how we can effectively reduce the gatherings, like during the Hajj or before the Hajj, so that the people don't gather at one point of time in Hajj. So this had three themes: healthcare to increase, preventive measure to ensure health and well-being for all pilgrims, which is augmented by ongoing COVID-19 ban. This is about the last year. Then the mobility to ensure adequate availability and access to public and private transport. Now it is already very complex, actually, if we go there. So they announced this challenge to get the ideas and from the people. Then the crowd management to enhance infrastructure to meet capacity requirements for the large crowds. And that is the end of this presentation. Now I am thankful to all of you, and the discussion is open for any questions.
Okay, thank you, Professor Suleman. Sorry. Okay, thank you, Professor Suleman, for your informative and interesting lecture. I will open the question and answer session to the students all. Is there any question? Please ask directly. Open your microphone, and or you can write in the chat menu. Please, student, is there any question? My question from me, Professor Suleman.
Yeah.
I imagine that in the future, what if any big outbreak in the future? We hope not. We hope not. Is there any mitigation plan from government to control this outbreak? For example, this is the big outbreak, to prepare the quarantine place, or to prepare the readiness of the hospital, and so on.
So regarding this, actually now they are so much careful that not just only for Hajj, even those people who are coming to work in Saudi Arabia, they have mandated it. First thing is you have to get vaccinated. You will get those vaccines. Then you have to produce this vaccination certificate. Then you will be allowed to come. And if you don't have, you you are required to quarantine inside Saudi Arabia for 14 days, and the amount you have to already pay. So this is how they are doing just for the normal people. So just imagine if it is for Hajj or for any religious gathering, how much careful they would be. So they are well equipped and well prepared for any kind of food clips.
Okay. And the history, is there any bit of break in the Hajj, in the middle of Hajj, for example, MERS or other outbreak with the big patient, for example?
Uh, there is no such thing, but actually, in the old times, there used to be cholera outbreaks
Hmm.
before, but it is definitely the system was not that strong that they would be informed or they would get notification well in time. So it would happen later on, like I gave example of 2010 when there was cholera outbreak for the people who were returning.
Okay.
So this has been happening, but uh, not because of disease, but couple of years ago there was there is always some construction going on in this Khana Kaaba. So there was some accident couple of years ago. The one crane fall and several people actually died. Several hundred people died in the during the Hajj.
Okay.
But that was not a disease. That was like an accidental thing. So these things. That is
Uh,
why they are always expanding it to accommodate more and more people.
okay. As far as I know, the government is still close the pilgrim, right, Professor? Or they
No,
open?
it is. Yeah, Umrah is open since I think since last year November the Umrah is open, and uh, this year they have announced already that 60,000 people will be allowed to perform Hajj.
Oh, okay.
The applications are open, but nobody from outside of Saudi Arabia is allowed. Only the people who are inside, they will be allowed to apply and perform Hajj.
Uh,
60,000 is the capacity.
because yesterday I watched the Euro tournament between Portugal and Hungary. There are so many spectators over there, and the UEFA said that because the spectator is vaccinated, so they can come to the stadium, watch the match between Portugal and Hungary. And what about in Hajj? To the vaccinated people, they are able to come to the Mecca, or what about
Uh,
this?
Definitely, they have made it sure that no one is coming from outside. If you are inside, you have to have vaccinated, and 2 weeks should have already passed. If you are within 2 weeks, still you are not allowed.
Yes. Okay. 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 The question is from our students. Mamlu Atul, you will ask by yourself, or I will read your question here. Okay, I will read the question here. Hello, Professor Suleman. I want to ask, this year the Indonesian government cancel the pilgrims, as well as Saudi Arabia, which limit the pilgrims only for its citizens, only internal Saudi Arabia. If one day vaccination have been given to almost all people, is it enough to be reason to reopen the pilgrimage for everyone, or restriction must still be carried out?
Actually, if we see from the scientific point of view, because we don't have the data about even these vaccinations, we need to have this post-marketing surveillance even for all those drugs. But we see this vaccine is coming within 1 year, and we don't know what kind of side effects are expected next year or after 5 years. Not only for the diseases, but also for these vaccines. So that is why they are giving vaccine, they are observing the things. Till they are not sure, I don't think so they are going to make it open. Like they are giving a capacity 60,000. Last year it was 1. So next year maybe they will make it 1 lakh. But first they have to make sure that there are these medicines, these vaccines are safe, there is no side effect, there is no issue with that. Till they are not sure, it is too early to say that they are going to open it, not just for Hajj but globally.
Okay.
There are
Next.
6 and 7 different vaccines, and for some, there in one country one vaccine is allowed, in another country another vaccine is allowed. For example, if you want to go to Saudi Arabia, they are not accepting this vaccine which is being given in India and Indonesia, the China one. They are accepting the vaccine, the Moderna and Pfizer, which is coming from America and UK. So this is another issue now.
Okay, okay.
First they have to come to one fixed point, fixed agenda, like okay, this is the vaccine, this is accepted. Otherwise it's another political war, like the people from India cannot come, the people from Pakistan cannot come, the people from America can come. So this is still a mess.
So it means the government only accept, uh, eh, not accept the Sinovac vaccination.
Yeah, it is. Right now I am in Oslo. In Norway, they are not giving this vaccine, which is AstraZeneca, which is being given in UK. So they are giving this Pfizer one. In America, they are giving Moderna. In Taiwan, they are giving Moderna. So it is quite confusing. There is no consensus.
Okay. But I
WHO,
think
WHO is approving all of these vaccines, but they are not even following what WHO is saying.
okay, I do agree. WHO accept all the kind
Yeah,
of the
yeah.
vaccination, right? Okay. Next question from Dr. Sri. What is the prevention for pandemic during Hajj activity, especially in throwing the stone? Jumrah, yeah, I think in the Jumrah, throwing the
Yeah,
stone.
yeah, yeah. And Rami Jamarat, I think I mentioned it already during the slide. The pebbles, they are giving this, I think, certain amount, and they are already sterile. They are sterilized. So there is no, you are not going to pick it yourself. They will give you those pebbles, which are like whatever you have to throw, and they will be sterile. There is no chance of spread from those pebbles.
So the pilgrims still keep distance between among others and still doing the throwing the Jumrah, or
No,
they
no, no.
can.
It is. I told you they made the groups, 20 people.
Oh, okay,
So
okay, okay.
like you are in a particular group, your bus is going, and
Yeah.
then you will throw. You come back, and then the next group, like that,
Oh,
to
okay.
avoid any kind of gathering. They have this system.
Okay. Next question from Dr. Dina. How about the pilgrims' adherence response the regulation related to COVID-19 prevention so far?
Uh, Now, actually, if you want to even enter inside the boundaries of Makkah and Medina, you should have a permit. During the on way to Makkah, they will check. Okay, now once you are in your hotel or the place where you will stay, they issue you a permit to perform the Umrah or Hajj, and there is a specific time which is mentioned on your permit. You have 3 hours. So once you enter, the outside of the Hanakaba, they would check your permit. There is application, there is a permit in that. They will scan the QR code to make sure like you are the right person, check your identity. And then again, once you are about to enter, they will again check your permit. If there is any another thing in the in between, there is a transportation service. They are again also going to check your Hajj permit, your timing. Then they will take around and bring you in front of the Hanakaba. There is a team of the those security people. They will check your permit in your application on the mobile and check if then you are allowed. And then while you are inside the Hanakaba, they have put the staff which is checking to make sure that you are following the line and you have enough distance. They don't let you be close to those. But this is what is happening currently during the Umrah.
Mm.
Yeah.
Okay. Next question from Reza Fina. Beside we have to comply the health protocols, is there any special training for the pilgrims before
For
doing
the
Hajj?
Yeah, there is always they provide not only the training but also some booklets. As far as in Pakistan is concerned, I know they would give those. There are camps specifically where you would go. They would brief you about it, how you have to perform it, and then they would give you a booklet which explain all the situation. And now I think they have already developed one application also which guide you while you are inside the Khana Kaaba, like which way to go and from where to start and where is what. So they are using these digital tools.
Mm. Okay. Next question is from. Oh, enough. My question. I have some question. In the history of Saudi Arabia, is there any, for example, screening procedure in the future? For example, the government open to all people in the world. Is there, for example, a screening for people outside the Saudi Arabia who
I
will
I
come
I,
to
I
the
sup-
Hajj?
yeah, I suppose from now for the general people before they were not allowing them to travel. Like if you want to travel, you have to have this PCR test. Now they have make it mandatory to have this vaccination. I think from next year they would allow all the people to come, but they would make it tough. Like the people with the chronic diseases, the old people, probably they will not allow them. But the young people, healthy people, vaccinated, I think from next year it will be okay. It will be fine because
Okay.
now they have. Almost open. The people can come, especially the lot of people come for work actually. So now the vaccinated people are going
Okay.
from
I
next year
think.
possible.
Okay. I think it is enough, Professor. There are no more questions from the students, and we come to the end of our session. I would like to say thanks again to Professor
Thank you.
Suleman for your informative class, for informative lecture, and to students, please give once again a big applause for Professor Suleman. Thank you for your coming here. And before we close this session, I would like to invite all the students to open the camera and take a picture together. Please open the camera. Okay, please open the camera. Okay, I will take a picture. The time for taking a picture, you can open the camera. Okay, I will take picture from slide number 1. Okay, layer number 2, please show your smile. And then layer number 3. Okay, I think is enough. Thank you to Professor Suleman
Thank
again.
you so much. Thank you so much.
We are happy
Thank
to
you,
have
Dina.
you in this class. Thank you, Budina. Thank you, Bu Sri Sumarti Ningsih. Thank you, all students. And before we close, I will share the certificate Izwan links. So you can click this link. Please be sure that your email address is correct. And the certificate will be sent to your email address. And the link is active for only 60 minutes after this class is over. Thank you for your kind attention. I will close with Assalamualaikum warahmatullahi wabarakatuh.
Walaikum Assalam. Thank you very much, everyone.
Thank you, Professor.
Bye bye.